Knock, knock, knock. Hi, my name is Susanna. I'll be your student nurse today. Can I have you confirm your name and your date of birth, please?
Roxana Aguilera, Mag 401.
I'm just gonna assess your bracelet just to make sure that it matches, okay? Perfect. Great, thank you. Okay, so I am just gonna go ahead and assess. So you're gonna feel me touching you. So I'm gonna be checking your breast, be checking your abdomen, also gonna be checking your episiotomy as well as your anus, just to check to make sure everything's okay. Okay, you can tell me to stop at any time. Okay.
Okay.
So I'm gonna go ahead and perform hand hygiene. I'm gonna put some gloves on. Okay. Okay. And let me just first start off by just checking your vitals. So it looks like your temperature, your blood pressure, your pulse, and your respiratory rate were all normal, which is perfect. And this is your first pregnancy, correct, or your first baby?
Yes.
Okay, great. So I'm gonna just start off first by just assessing your breast, and then you're gonna feel me touch your breast and around your breast, and I'm also gonna check up to your axillaris. Okay. Do you have any pain or any tenderness in your breast?
No.
No? Okay. So I'm just gonna feel. Okay, good. So I don't feel any lumps or anything. Patient denies any pain, any tenderness. Good. Let me see. Okay, good. And they look symmetric. I don't see any redness, which is all a good sign. So then I'm just gonna move on to your abdomen. Okay. So I'm just gonna feel. Good. And I'm just gonna take a listen to see if I hear any bowel sounds. Have we had a bowel movement today?
Yes, this morning.
Okay, great. How was it? Was it normal, hard, loose?
Normal consistency.
Okay, that's perfect. So I'm just gonna listen to all 4 quadrants, okay? Start right lower quadrant. Good. Right upper. Good. Left upper. Good. And left lower. Good. So I definitely hear bowel sounds. I hear about 5 to 30 within a minute. Okay. And then, have you urinated today?
Yes.
How long ago did you urinate?
Maybe like half an hour ago.
Okay, great, perfect. Do you have any pain when you go to the bathroom? Or
no.
Okay, that's good. So I'm just gonna go ahead and feel your abdomen, okay? So I can't palpate it, so that means that is good. You just went to the restroom too, so I shouldn't be able to palpate it. Okay, so I'm just gonna feel your fundus. So I'm gonna put my hand on your pubis bone here, and then I'm just gonna look, okay? All right, perfect. So it looks like your fundus is right on midline, right above the umbilicus, which is right where it needs to be after delivery. So everything looks like it's measuring up where it needs to be. Okay, so I'm just gonna go ahead and have you turn over towards that way, just so that I could assess your anus. Okay, good. So I do notice a hemorrhoid, but it looks like it's just a dark red color, which is normal, especially after pushing. And I'm looking at your episiotomy site, and it looks really good. I don't notice any redness, no discharge, and it looks like the sutures are good, placed close to each other, proximity to each other, so everything looks really good. No discharge, like I said. What about your lichia? I'm gonna have you had how does your vaginal discharge look?
It looks normal. I think I change it like every hour.
Okay. Do you notice any odor to it?
No.
It just smells like your normal menstrual cycle?
Yeah.
Okay. And how many times are you changing it, or how long or how often are you changing it?
Every hour.
Every hour? Okay, that's perfect. So that's like moderate flow, so it's not too bad, but we want to definitely keep an eye on that. If it gets to anything over 15 to 30 minutes where you're changing your pad constantly, that's where we start to worry a little bit. Okay.
Okay.
And then I'm just gonna take a look at your legs. Okay.
Okay.
Okay. Good. So your legs look good. I don't notice any discoloration or any swelling, but I'm just gonna feel them. Okay. Okay. Good. they feel warm to the touch. Okay, I don't notice any edema. Do you feel me touching your legs? Okay, that's perfect. Okay, good. So we want to just make sure that there's no, no clots in the legs, which is sometimes it is normal, but it's something that we want to catch early, so that's why I'm just checking, okay? All right, so my physical assessment is done. Do you have any questions?
No.
No? How are you feeling?
I feel fine.
You feel fine? How are you and the baby doing?
We're fine.
Okay. I'm just assessing your emotional state because postpartum depression is very, very common in new moms, especially because I know being tired and everything is normal, but sometimes if it lasts a little bit longer than a couple days, then that's when we start to worry. And then I'll just give you some brochures for new moms, just give you some readings on what to do and what to expect, and then give you some numbers just in case you do end up needing any counseling or anything like that. Okay? So since you are, or were, I'm sorry, Rh negative, we're gonna go ahead and give you a RhoGAM shot because baby was born with blood type of red H positive. Usually we give that within 72 hours after birth. So I'm gonna go ahead and give that to you. So I'm gonna go ahead and go grab that, and then I'll be right back. Is there anything that I can do for you now?
No.
No? Okay. Here's the call bell, and you call me if you need anything, okay? I'll come check on you in a little bit. Okay. I'm gonna perform hand hygiene. Okay. I'm gonna go ahead and chart my findings today. And that's it.